Hello, my name is Delaney Kimberlin, and for this presentation, I will be doing it on multiple births. Let me pull up my PowerPoint, share screen, this one, share it. Okay, so let me pull it up. Okay, so as you can see, my presentation today is on multiple births. So I actually have a personal connection to this topic. I am an identical twin, and I have a set of fraternal twins in my family, as well as a set of identical twins. My dad's cousins and a pair of cousins on my mom's side. So I was born a month premature and have thus heard the stories of my mom's pregnancy. I was supposed to be born in October, but instead, due to issues like me sitting on my twin sister's head, I was born a month premature. I was born early. So I have seen firsthand the effect it has on families, as well as the effect that, or how it has raised since I was born. Definition. First, we have to look at the definition of a multiple birth. What is a multiple birth? So what it is, a multiple birth is a pregnancy with just 2 or more fetuses. That is where it ends. No complications to it. But due to the different sets of multiples you can have, there is a large amount. So this can include twins, triplets, quadruplets, sextuplets, septuplets, octuplets. That is what it can include. Now, twins can actually be split into 2 different categories, as can most of them, but twins are the ones that I know personally, because you can have a set of identical or a set of fraternal twins. And all identical and fraternal means is that with identical, it is one egg that in the process of fertilization, it splits into 2. Whereas fraternal twins are just 2 different eggs that are fertilized at the same time. So identical twins have the same exact DNA, whereas fraternal twins, think of them as siblings that are born at the same time. They can look incredibly different. And to be fair, so can identical twins. But identical just means that their DNA is exactly the same. Okay, next we have to look at natural causes of what can cause having multiples. So let's look at race. So African American women are more likely to have twins than any other race, where Asian and Native American women are actually the lowest likely to have multiples of any kind, twins, triplets, any of it. Next, we also have to look at age. So women over 30 have a greater chance of multiple births. However, this does not mean that if you're under 30, you're not going to have multiples, because that just isn't true. My mom was under 30 when she had me, and she had twins. So next, we have to look at drugs and other causes. What kind of drugs could be causing multiples? So there's medications called ovulation stimulation. These could cause multiples. 2 examples of this are clomiphene citrate and follicle stimulating hormone, also known as FSH. So some other causes that are drug related are assisted reproductive technologies. So like IVF or even like surrogacy and all that could increase the likelihood of having multiples. So next we have to look at why are more people today having twins than before. So we could look at a higher maternal age. Women are waiting later to have families, so they're waiting till they're 30, which we already talked about how women over 30 have a higher chance of multiples. They're waiting till they're financially stable to have kids, which is very smart. Next, and this I already talked about, fertility treatments like IVF, that they are increasing the likelihood of having multiples. Something else that increases the likelihood of having multiples is the weight. If you're in a higher weight bracket, it makes the likelihood of having multiples increase. Next, we have to look at the effect it has on families. When you have multiples, you are paying for more things, so your cost of living goes up exponentially. Examples of this can include Diapers, a vehicle, like a larger vehicle, an expanded living space, so like a larger house or a larger living space, healthcare, you are paying for more children, so your healthcare is increasing, whether that's just for individual visits or like a health plan. Okay, so less time, due to the fact that you are caring for multiple children, you may have a sense of increased guilt or sadness due to not being able to feel as in control of caring for these other children. Next, higher stress is very likely in those that have multiples, due to the less amount of sleep that you have as a parent. Next, we have to look at risks. When you have multiples due to some of these other issues, you may give birth a little bit more early than you might if you just had one baby in there. I know I was born a month in advance. I know some twins that were born nearly 2 months in advance. It just depends. With me, it's because it was thin on my sister's head and she could not grow. High blood pressure, another risk. High blood pressure is extremely common in those with multiples, whether that's during the actual pregnancy and then it goes away, or if it's during the pregnancy and you have high blood pressure for the rest of your life. So multiples also have a higher rate of birth defects. An example of a birth defect in multiples is spinal bifida. Another example of a birth defect is twin-to-twin transfusion syndrome. So this happens and this only happens in twins. It's where one twin gets too much blood in their system because the blood from the other twin via the umbilical cord is, instead of staying in that one twin, it goes to the other one. So one twin gets too much blood in their system and the other one gets too little. And that can also lead to an early birth. So next we have to look at ethical issues about having multiples. So this could include, because fertility treatments, as I already talked about, are increasing the likelihood of having multiples. Some experts believe that you are playing God with the fetuses, because if you were meant to have kids, you would have them naturally. I don't agree with that, but that is what some experts believe. So the question I ask you is, would having to get pregnant via doctor's permission lessen the amount of multiple pregnancies? Would having to verify with your doctor you're of the right weight, you're of the right age, you don't have any family history of having pregnancies, would having to get pregnant via doctor's permission to give you the go-ahead, would it lessen the amount of multiple pregnancies? And then here are the resources I use. I use Beaumont Health, Fiero, at the Very Well Family, ML Gavin at Kids Health, at the International Journal of Gynecology and Obstetrics, and then the Stanford Medicine Children's Health Facility are where I got all my information.